ශ්‍රී ලංකාවේ ප්‍රථම වරට SLT 4G වෙතින් දැන් Pure TV නරඹන්න. ඉදිරියටම ගෙන යන SLT 4G.
ලෙන්ගතුකම වැඩි කරගන්න ලව්ජු රුපියල් 50ට අඩු කළා.
මාමේ එන්න අපිට එකක් බොමු.
Tonight, mitigating an outbreak. Colombo, Gampaha and Kalutara identified as high-risk zones. Curfew imposed indefinitely. Advice falling on deaf ears. Indifference to fellow man on display as some disregard safety protocol when shopping. Growing concern. Sri Lanka's positive coronavirus infections breach 100. This Tuesday, the 24th of March, 2020.
From AdaDerana, this is AdaDerana First at 9.
හැටනමයි අනුහතට SMS කර රුපියල් මිලියන 3ක මුල්තැන්ගේ උපකරණ දිනාගෙන අවුරුද්දෙම කුස්සිය ටයිම් සේව් කරගන්න.
Live from Studio 24 in Colombo.
Good evening and a warm welcome. This is your English news service on AdaDerana 24. The districts of Colombo, Gampaha and Kalutara are now classified as high-risk zones by the government as Sri Lanka battles to curb the spread of COVID-19. As a result, the curfew in these three districts will remain in place until further notice. Taking into consideration the risk posted when people flock to markets and other stores during curfew breaks, the government has also put in place measures where goods will be delivered home.
The President's office announced today that the curfew imposed in the districts of Colombo, Gampaha and Kalutara will continue to be in effect until further notice, as these areas have been identified as high-risk zones for the coronavirus COVID-19. The ongoing curfew will be lifted in Puttlam and the Northern Province at 6 am on Friday the 27th and will be reinstated at 12 pm the same day. In the remainder of the country, the curfew will be in effect until 6 am on Thursday the 26th and will be reinforced again at 12 pm on the same day. The President's office states that people were observed gathering near shops in large numbers when the curfew was lifted in three districts today, which poses a serious threat to the fight against COVID-19. Therefore, the government has instructed wholesale trading companies to conduct door-to-door sales in the coming days. The likes of Satosa, Keels, Laughs, Apico, Cargill's Food City, Aralia, Nipuna and other wholesale companies are to be involved in the task. Meanwhile, a task force headed by Basil Rajapaksa has been established to make certain that the operations are carried out efficiently. The rest of the task force is comprised of ministerial secretaries, government agents, divisional secretaries and other relevant officials. The plans in place to uninterruptedly supply essential goods including food items, medicine and LP gas to the public will be implemented from tomorrow. Furthermore, all delivery vehicles used to distribute goods including lorries, vans, three-wheelers and motorcycles will be allowed to travel along roads during curfew hours. With the curfew being reimposed at 2 pm today, the entire country is now under lockdown. At a time where movement between districts is restricted, police gave strict advice to a group of people awaiting buses. A similar incident occurred in Colombo as a number of people who attempted travel to Kandy were sent back by the police. Meanwhile, according to the police headquarters, 2,262 individuals have been arrested over curfew violations during the past few days. 579 vehicles have also been taken into police custody. Common among the offences committed during curfew hours are the use and sale of liquor and unnecessary loitering. Meanwhile, a person who had been selling liquor in the town of Trincomalee was arrested by Fraud and Anti-Corruption Unit of Trincomalee. By the time of his arrest, the individual in question had sold liquor worth 200,000 rupees.
Well, given the current situation, a disease or a virus that was completely unknown to the medical and scientific world could be overwhelming, facing these fears, being able to cope with these fears of anxiety, depression while you're at home is also important to manage. So to discuss all of this, we've invited to our studios to join us via Skype, clinical psychiatrist Dr. N. Kumaranayaka. Thank you for joining us, Dr. Kumaranayaka. As I said, about a disease, it's anxiety, depression, fear, and this is also a virus that was completely unknown, not just to the medical and scientific world, but people were taken by shock and fear. In Sri Lanka, curfew has been implemented. There were breaks, but then indefinitely implemented while you're confined to your homes. And again, there are other issues. Will you catch the virus? How do you manage your economic situation? How do you manage your food situation? How do you continue lifestyle? If you're running a business, what's happening there? But amid all this, it's very important that we maintain our sanity. So we'd like to talk to you about this. So what do you think we should be mindful?
Yes, this is a global pandemic and global anxiety. Nobody could escape from it. I think this is a new experience for us. Rare experience. Even during the war situation, it is partly confined to a part of the country. This is global. I want to tell you, in this situation, we are away from our family. We are away from our friends, husband, wife, children. Sometimes they are abroad. Now, in this situation, this anxiety, we become victim of this anxiety. We should know how to overcome this anxiety. Otherwise, this anxiety could lead to depression. What is this? What kind of anxiety that you will face really? Now, at home. Now, I want to tell you a story. One lady from Kurunagala called me 1 week back. Husband is abroad in Italy. Now, 2 children. One child is 10 years and 5. Now, she can't sleep, lack of sleep, poor appetite, lack of energy, anger, irritable. She can't function day-to-day life normally. Now, thinking about what to do. And she called me and asked help. Actually, this current situation, the curfew and things that she can't come to Colombo and meet me. So I give some tips how to overcome this. One is drink a lot of water. Second is very important exercise. Even you can do at home. More inside the home. That will reduce your anxiety. Other thing, breathing exercise. Very, very important to reduce anxiety. Breathe in and out 10 minutes at a time, twice a day. So very effective way of reducing your anxiety. Other thing, family meeting. Family meeting, not the outside meeting. Within the family members, you with your family members, singing, dancing, talk to each other, and have a nice time with your family. And away from alcohol, away from smoking. These two are very hazardous.
Doctor,
why?
Sorry,
alcohol and
to add to that,
smoking both will reduce your immunity.
Right.
You are prone to get virus easily.
To add to that, I'd also like to ask you, Dr. Kumaranayaka. To add to that, I'd like to ask you, Dr. Kumaranayaka, now, while you're at home, confinement, you sometimes feel claustrophobic too, especially if you're a very socially active person. If you may add to that too, how we can manage that. I think we have a...
Yes.
Do you hear me clearly, Dr. Kumaranayaka?
Yes, social active person now is at home. Now we know the various ways that you can act within the home environment. But very important is the psychological education. Psychoeducation means that you understand why you are staying at home. This is very, very important. This is only way to combat this virus.
Right.
Now, if you go outside and try to enjoy yourself with your friends, it does mean the virus really easily you get the virus to yourself. So, this 2 or 3 weeks with this curfew, the curfew has been imposed throughout the country. So, you can stay at home. And other thing, you try to find out too, what are the other means of enjoyment yourself. Singing, dancing, sometimes movies,
Right.
and various ways. Some people can do their jobs at home. So, when you are connected through computers and things, that some people I know, they are doing their jobs. Now, I want to tell you the most important thing, staying at home is the main way of reducing spreading this virus.
Certainly.
If you could stay at home 1 or 2, 3 weeks, definitely virus is away from us.
Thank you very much, Dr. Kumar Naika, for joining us via Skype from home to talk about how we can cope and especially manage our mental health and psychological health while dealing and coping with this outbreak in the face of a battle against COVID-19. And we move on to our other local stories tonight. People thronged to markets and other stores during the window of free movement today, where at most part the behavior of the people was in line with the safety protocols introduced by the government. Long queues were seen outside supermarkets, with some stretching over a kilometre. The day wasn't without disappointment, as some completely disregarded the safety protocol introduced in the fight against COVID-19.
Curfew imposed in Colombo, Gampaha, as well as in 5 districts of the northern province was lifted at 6 a.m. today. People lined up at supermarkets in long queues during the window to restock their supplies. Significant crowds were seen outside shops, banks and pharmacies as well as fuel stations today, with some queues even stretching over a kilometre. Most of the people who lined up outside shops were seen following safety protocols issued on the prevention of COVID-19 spread, as they wore face masks and maintained a distance of at least 1 metre. A woman was seen outside a supermarket in Maharagama covering her body with sacks used for waste disposal. Consumers were assisted by the shop staff and security forces to purchase goods without facing any inconvenience. Just as in Colombo, residents in Gampaha and in the northern province were seen patiently awaiting their chance to purchase goods outside shops. Observing massive queues at markets and outside stores, the government took measures to extend the window of free movement by 2 hours, reimposing the curfew at 2 p.m. instead of 12 p.m. Acting Inspector General of Police C.D. Vikramaratna requested shop owners to provide goods to the very last consumer, even after the reimposition of the curfew. Despite explaining the severity of the coronavirus situation many a time, some people failed to heed the safety protocol. Indiscipline of some people was on full view at Manning Market Complex in Peta this morning. This manner of disregard towards the well-being of fellow human beings is both shocking and unacceptable. as the country attempts to overcome the most vicious of virus outbreaks, which has already claimed the lives of over 17,000 people across the world. Callousness, ignorance and indifference of some beggars belief.
And we take a short commercial break. We'll talk about fake news in the face of a fight against COVID-19 when we return.
අවශ්‍යයෙන් ඔබේ මුළු පවුලම 100% දක්වා විෂ බීජ වලින් ආරක්ෂා කර දෙයි.
Sri Lanka Air Force today rubbished a message being circulated on social media which claimed that disinfectant liquids would be sprayed from the air using helicopters. The Air Force insisted that such operations will not be carried out by them. How do we understand fake news, disinformation and be responsible citizens as the government and the rest of the world is battling a deadly virus? I've invited to our studios to join me via Skype social media analyst Mr. Nalaka Gunawardena. Mr. Gunawardena, thank you for joining us from your home via Skype. I know it's not possible to have you here in our studios, so hence we discuss making all technological possibilities in our favor to have this discussion.
Thanks for having me.
How do we responsibly understand the difference between fake news, misinformation and be responsible citizens, Mr. Gunawardena, in the face of an outbreak, especially when people are panicking already about a virus?
Yes, indeed. Now, we are having parallel challenges, as the Director General of the World Health Organization, WHO, said a few weeks ago. There is a virus that is causing COVID-19, the illness, and then there is also an infodemic. He called it parallel to the pandemic. There is an infodemic, an explosion of false or misleading information related to this illness that is spreading through mainstream media, as well as social media and the web, and that is causing confusion and sometimes panic. So if we want to if you want to beat Corona, basically, we need to contain not just the virus, but also the prolific volumes of disinformation that is flowing through various information channels right now. It's a huge challenge.
A huge challenge, but what are the basic measures and basic things that anyone should consider before forwarding any message, any social media message or something you see on Twitter, and just subscribe to responsible sources of information and news?
Absolutely. So, for example, today we've seen many people uncritically sharing what turned out to be a completely bogus conspiracy theory or fantastic tale that the Air Force is getting ready to spray some kind of a chemical to counter the virus.
Right.
Officials had to deny it. So when we receive this or other suspicious, dubious information through WhatsApp or Twitter or other methods, including mouth-to-mouth rumors,
right.
We all have to be skeptical, extra skeptical these days. Just as we are being extra careful, social distancing, we are washing our hands more often and more carefully, we also have to up our skepticism. We need to ask, is this possible? Is this credible? Now, who is saying this? For example, when we get something that is attributable to official sources, we can't just rely on something that doesn't name an institution or an official. If it is about the virus, we need to see whether it is from the highest levels of government, the political side of it, or the medical experts in the health ministry. The Ministry of Health is doing a fantastic job in giving information to us through the health bureau, the public health bureau, as well as the epidemiological unit of the health ministry. We need to rely more and more on such official sources, and also be very skeptical about if something is too good to be true, then it is likely false. And there is a small group of people who seem to take delight in fabricating these kind of false information, and that is what you call disinformation, intentionally false information. And then when it's released, a lot of people uncritically, without thinking too much, share it. Then it becomes misinformation. So we inadvertently might be peddling misinformation. This is what we need to guard against.
Now, there are some amazing tools also in place to combat misinformation. Social media providers, WhatsApp, Twitter, Facebook, they too have understood the critical issues that are consequences of fake news and disinformation circulating. At the same time, while we remind them of that, you told us about fact-checking. We speak about this as journalists, but as citizens, as individuals, how do we take this responsibly and how do we move forward?
2 or 3 tips I can give. One is there are already a few reputed, journalistically driven fact-checking services in Sri Lanka. There is Watchdog, that is available on Twitter, and you can also access them online on their website. There is the AFP, French news agency, doing AFP fact check, and there is also News Crescendo, or Fact Crescendo rather, that is also offering fact checking on what flows through Facebook in particular.
Right.
So at local level, we can look at these fact checking services and see what is being debunked, and then we can be aware and be more vigilant. Then at platform level, Facebook, Twitter, and other platforms have started actively trying to spot disinformation and trying to take them out, and also to promote the credible sources of information. WHO, the Centers for Disease Control in the US and elsewhere, and the likes of that. And in this country, the Health Promotion Bureau and the Ministry of Health. The authoritative sources about COVID-19, as well as the government responses to it, we need to turn to those. And increasingly, these official sources are communicating in non-technical, everyday language that non-specialists, non-medical specialists can understand.
Thank you very much. Yes.
One thing is, I think we still need to improve how officially the government itself communicates practical precautions and information to the public. For example, today, the Director General of Health Services had said that it is not compulsory for us to wear a face mask as we step out, as the curfew was lifted in certain districts. And yet, we've heard from many areas that police was turning away citizens who were without face masks. So there is some kind of confusion, and when there is mixed messaging and contradictory information, the public gets confused. And then in that void of confusion comes disinformation. So one other way to counter disinformation is to have very clear, very consistent messaging from the official sources, whether it is the police or the defense hierarchy or the health officials.
Certainly. Thank you very much, Mr. Gunawardena, for your thoughts as Sri Lanka not just battles a deadly virus, but also fake news and disinformation. Moving on to other stories, the Ministry of Health today placed the number of COVID-19 infections in the country at 102, with an overnight total of 5 cases being added to the tally. Director General of Health Services, Dr. Anil Jasinger, revealed that a community physician at the Infectious Diseases Hospital has also contracted the virus. Meanwhile, in other developments, over 300 people left quarantine centres today after completing their mandatory 14-day stay at the facilities.
The epidemiology unit reports that 224 locals and 5 foreigners are under medical supervision across 19 hospitals island-wide. 10 fresh cases of COVID-19 infections were detected yesterday. Among them are 5 from the Kalutara district, 4 from the Colombo and Putlam districts, while the remaining patient was the first to be found from the district of Matara. The highest number of COVID-19 patients detected are now being treated at the Infectious Diseases Hospital, and the number stands at 86. 8 more are being treated at the Valikanda Base Hospital and 1 at the Mulleriava Base Hospital. A resort owner and his family was taken under quarantine for 14 days after they accommodated a tourist transporting driver who was found having contracted coronavirus. The resort, which was also maintained without permission, was also sealed following the incident. Meanwhile, public health inspectors have taken steps to self-quarantine more than 50 suspicious persons who had returned to Kantale area after leaving to various cities for employment. In order to prevent the spread of this deadly virus, more than 3,000 people are now under quarantine at 45 centres island-wide. The first batch of 311 people quarantined at various facilities were released today. They were returnees from Italy, Iran and South Korea. 203 people quarantined at the Punani facility were released. 108 people were released from the centre in Kandakadu after being quarantined for 14 days. The group, which consists residents of Kandy, Gaul, Matara and Colombo, was transported to the respective areas by the army and handed over to the area police. They were later sent to their homes with the intervention of the police. Meanwhile, at the Kandakadu quarantine centre, 62 persons who completed the quarantine process were brought to the Velagedara Stadium in Kurunagala this afternoon. They were then handed to their relatives. Meanwhile, 12 people, including 10 Koreans, were released after completing the quarantine process in the area of Haldanduwana in Dankotua. Among them are 2 Sri Lankan youths. Meanwhile, the Public Health Inspector's Office of Homagama issued a certificate to 11 persons in Migoda for completing the quarantine process after returning from Italy. Meanwhile, the Sri Lanka Navy took measures to quarantine 112 people, including guards to international trade vessels and the people who came into contact with them. Among them are 76 foreigners and 36 Sri Lankan residents. In the meantime, the police released information about a group of people returning from Italy who evaded the mandatory quarantine process. Among them are 7 children below the age of 2 and 2 children aged 6 and 7, as well as 27-year-old named Rajmithun Tavaraja and an 80-year-old named Hettiarachige Alfred Tissera. The police calls the general public to contact these numbers if they possess any information regarding these people in question. The numbers are 119-071-859-1864, 011-244-4480, 011-244-4481.
කොරෝනා වෛරසය පැතිරීම වළක්වන්න සබන් යොදා දෑත් සෝදන්න.
President Gotabaya Rajapaksa established a special fund yesterday to strengthen efforts aimed at controlling the spread of COVID-19 in the country. Donations can now be made to the COVID-19 Healthcare and Social Security Fund, and several donors have already expressed their willingness to donate money for the fight against the pandemic.
Following the novel coronavirus outbreak in Sri Lanka, President Gotabaya Rajapaksa established COVID-19 Healthcare and Social Security Fund to strengthen efforts aimed at controlling the spread of COVID-19 virus in the country. Starting things off, the President instructed to donate 100 million rupees from the President's fund for the cause. Money can also be donated to the fund via Bank of Ceylon corporate branch account bearing the number 85737373. Meanwhile, issuing a statement, the National Academic Bhikshu Forum stated that the Presidential Advisor on International, Cultural and Religious Affairs, Vice-Chancellor of the Nagananda University of Kalaniya, Venerable Dr. Bodhagama Chandimatera, has agreed to donate 10 million rupees to the fund. Furthermore, the Bhikshu Forum stated that the monks and members of the forum have also agreed to donate money to the fund.
A meeting to discuss the current situation prevailing in the island, prompted by the novel coronavirus outbreak, was worked off under the patronage of Prime Minister Mahinda Rajapaksa at Temple Trees today. The steps taken by the government to curb the spread of the virus were discussed during the meeting.
අපිට ඇඳිරි නීතිය උවමනයි තව කාලයක් ගෙනියන්න ඒත් ග්‍රාමීය ආර්ථිකයේ ප්‍රශ්නය මම හිතන්නේ කතා කරොත් අපිට විසඳ ගන්න පුළුවන් අනික උවමනා නැති රජයේ සේවකයන් සියලු දෙනාටම නිවාඩු දෙන්න මම කියන්නේ පුළුවන් තරම් ටෙස්ටිං ඉක්විප්මන්ට් ගේන්න අනික අපිට බැරිද වෙන්ටිලේටර්ස් ලංකාවේ හදන්න දැනට පේරාදෙණිය විශ්වවිද්‍යාලයේ ඉංජිනේරු අංශයෙන් හදන්න අවශ්‍ය පියවර
හාම්පොතුන්ගේ සම්මේලනය සම්පූර්ණ සහයෝගය දක්වලා තිබෙනවා. සීපත් කරන්න ඕනේ වතුකරයේ ඇතුළු සියලු දෙනාගේ වැටුප් දීමන හා අවුරුදු අත්තිකාල ගෙවීමට තාම පැහැදිලි බැඳියාවකින් පොරොන්දු දීලා තියෙනවා.
දේශපාලන වේදිකකින් තොරව මෙවැනි අවස්ථාවකදී ජාතිය බේරගන්න රට බේරගන්න ඔබතුමන්ලා එක්කහුව වෙලා අදහස් ප්‍රකාශ කිරීම ගැන මම ස්තුතිවන්ත වෙනවා. ඒ අදහස් දැනටමත් ජනාධිපතිවරයා පත් කරලා තියෙන කාර්ය සාධක බලකාය එක්ක වැඩ කරන්න අපි යම් වැඩපිළිවෙලක් හදනවා දේශපාලන පක්ෂවල නායකින්ට.
There is still no change in the global situation in the COVID-19 pandemic. In fact, it looks to be getting worse, with the numbers of fresh cases increasing with rapid frequency. The World Health Organization also agrees, saying the pandemic is accelerating. Over 600 people yet again died in Italy, while Spain also recorded its highest daily number of fatalities.
As of 4:30 p.m. Sri Lankan time, the number of infections globally were recorded at 391,947, with over 17,138 deaths. 196 countries and territories have now reported positive infections of the virus on their soil. As 2,503 people were confirmed as recovered, taking the global tally to 102,843, 1,875 perished in 24 hours. The worst hit country in Europe, Italy, continues to suffer heavy numbers in fatalities on a daily basis, in the excess of 500. With 601 deaths in 24 hours, the Italian government announced tougher restrictions during lockdowns. But as Italy enters its third week in extreme lockdown, the crisis is still far from being over for many in the country, as the current total of infections is recorded at 63,927, with 6,077 deaths. Spain, meanwhile, is catching up with Italy at an alarming speed, recording 539 deaths yesterday. The death toll in the country since 12 hours GMT is 385, well before the counter is reset. It puts Italy's overall number of fatalities at 2,696, with 39,673. In the meantime, Germany, the country with the third most COVID-19 cases in Europe, reported 29 deaths yesterday and 7 already today, putting the overall tally at 130. The country's total infections standing at 30,150. In the United States, there were 2,434 fresh cases and 140 new deaths. A further 29 fatalities were added to the total today, putting the US 6th on the global list with 582 deaths. The world's largest economy is also third in the world in the number of positive COVID-19 cases, with 46,168. In Africa, South African president announced today that the country would fall into a 3-week lockdown from midnight on Thursday. The country has reported 154 new cases, increasing the total number to 554. No deaths, however, are reported from South Africa. In the Middle East, Iran continues to battle the coronavirus COVID-19, with 1,943 people already falling prey to the virus. Its total infections are now just short of 25,000. South Korea's downward trend in new cases continues. Although there were fresh cases, they are in double digits. With 76 new cases reported today, South Korea's total number of cases is at 9,037, with 120 deaths. Meanwhile, South Korea says 90 of 1,444 passengers who arrived from Europe on Sunday tested positive for COVID-19. While China, the previous epicenter and origin of the outbreak of COVID-19, has been experiencing a rise in imported cases following the decline in the domestic cases, Authorities there says that most of the imported cases involve Chinese nationals who have travelled to China from overseas. China also announced that many travel restrictions in and out of China's Hubei province will be removed starting from today, with the exception of Wuhan, the provincial capital and epicenter of the country's coronavirus outbreak. Meanwhile, the World Health Organization warns that the spread of the pandemic is accelerating.
That's heartbreaking. We continue to hear alarming reports from around the world of large numbers of infections among health workers. Even if we do everything else right, if we don't prioritize protecting health workers, many people will die because the health worker who could have saved their lives is sick. Solving this problem requires political commitment and political coordination at the global level. This week, I will be addressing heads of state and government from the G20 countries. Among other issues, I will be asking them to work together to increase production, avoid export bans, and ensure equity of distribution on the basis of need. It's great to see the level of energy now being directed to research and development against COVID-19.
And that wraps up tonight's edition of First at 9. Thank you for watching. We'll see you again tomorrow, same time. Good night.